So I'm Sam Gidding, and I'm a pediatric cardiologist at Nemours AI DuPont Hospital for Children in Wilmington, Delaware. I think the issue of pediatric FH is critical because, as we've learned with treatment for people who are at risk for heart disease, the earlier you start, the better the impact. I think since atherosclerosis, which is the problem that causes hardening of the arteries and leads to heart attacks, is key to the disease, in pediatrics you're really working on making sure your patients have as little atherosclerosis when they become adults as possible. Now in FH, when you're exposed to high cholesterol for your entire life and that atherosclerosis begins very early, it's very hard for parents and families to understand that because their child has no symptoms whatsoever. Probably if you could put a blood vessel on the child's skin and seeing all the fat build up in that blood vessel, the parents could be proactive about knowing the benefit of early initiation of statins in FH. But unless they've had an event in their family or they know that heart disease is kind of looming over them, we really have a key initiative in pediatric FH is bringing out the understanding of the disease, that the atherosclerosis starts early, and you can essentially shut it down with early statin treatment, and possibly even with lower long-term lifetime doses if you begin early and get the numbers down so you don't have that long exposure to very high cholesterol levels before you start treatment, let's say in your 30s or 40s, when you may have very advanced disease. This leads to the question of how is the best way to identify kids with FH. Obviously, if a parent is known to have FH, we should begin cascade screening to identify those first-degree family members and their kids to pick off those with FH. But it's known that cascade screening by itself can't get everybody, nor can selective screening simply based on family history. So that some integration of cascade screening and perhaps universal screening may be key to accomplish the goal of picking off every kid with FH. Right now in the US, we're trying to screen all the kids at about the age of 10, but knowing, and the other good thing about screening in childhood is the LDL cholesterol alone is very sensitive and specific for FH. As you get older, there's other reasons for having high cholesterol, and screening on the basis of just the cholesterol or LDL cholesterol level isn't quite as effective. So one of the things that's really come up for discussion at this meeting, which is a little bit revolutionary, is maybe we should be even checking kids at a younger age, let's say about 2 to 5, because then we can almost be certain that those with the highest cholesterol do have FH. We can even identify their family members who haven't been identified as FH, their parents, aunts, and uncles, and also teach the kids about lifestyle, which has a huge impact on the outcome of FH. If an FH kid never smokes, doesn't get obese, plays sports, those kids are going to live 5 to 10 or 15 years longer just by having a healthy lifestyle independent of taking a medicine. And then on the doctor's side, I think we have to be much better at measuring disease progression and the atherosclerosis progression. We have some tools, but they're a little bit too imprecise to use in clinical practice right now. But if we had a really good measure to know exactly where a kid's atherosclerosis was at, that would allow us to calibrate the treatment not just to the cholesterol level but to the amount of actual vascular disease that they had. So there's lots ahead of us for FH in kids, getting the kids identified, helping parents understand the importance of early treatment, getting that concept of prevention out there both for the cholesterol level and the other risk factors, and then making sure that our primary care providers have a good understanding of FH, why it's so important to pick off these kids early, separate them from kids who are obese and overweight, who really need intensive lifestyle, and pick off those few kids who would really benefit from the early treatment with medicines. Happy?